Dr. Parsa Mohebi, Medical Director of U.S. Hair Restoration. I'm talking about the hair transplant and how it works. We want to have a quick evaluation of the process of hair loss, evaluation for hair loss, and finally treatment of hair loss. We do microscopic evaluation, as you could see in the other picture and in this picture. Doing a microscopic evaluation, we can see where on the scalp people are losing hair. Basically, hair on the back should have a better quality. If you look at the back and sides of the patients should all see better quality, thick hair. But when you start losing hair from the front, you start seeing these tiny hairs. So the hair loses its thickness and become finer and finer to the point that they're not existent anymore. This is called miniaturization study, and this is something that every hair transplant doctor should do prior to starting treating the patient. This is a normal hair in one of our miniaturization studies with minimal miniaturization. You see they're all pretty thick and having good qualities. They might have some smaller hair here or there, but if those fine hairs are less than 20%, that's normal, and we're not too worried about those. This is a patient who has significant miniaturization. You see the hair shafts are becoming very fine, and in between the patient has a lot of smaller hair. Hair transplant surgery, how does that work? Very easy. We remove hair from the sides and back of the head where patients had better quality hair, and bring them to the frontal areas, and the hair that is moved from back to front is permanent and it never loses its quality. So patient does not even need to take medication for transplanted hair, and it could be done in one or more than one sessions. One more time, a microscopic evaluation of the hair shows that hair doesn't grow in single hair. We are talking about microscopic follicular unit transplants. So follicular units are the grouping, the normal grouping of hair. Like as you can see here, the groups of 1, 2s, and 3s in both pictures. That when we do hair transplant surgery, we dissect the grafts into those natural groupings, and every graft should have between 1, 2, 3 hair. Microscopic follicular unit transplant is something that has been around for over 10 years now, and that's pretty much the gold standard of hair restoration. That's the same way that hair grows in nature, and we don't want to change it. So after hair transplant in natural, the result should be perfectly natural and undetectable from a normal head of hair. Follicular units are, as I said, the hair follicles could be grouped into group of 1, 2s, 3s, 4s, occasionally 5s even. But these are the examples. On the left you see single hairs, on the right you see 2s. We have two different types to extract hair or to remove hair or to harvest hair. One is by removing a strip from the back of the head. The other one is FUE, or follicular unit extraction. Let's go over those two options. Starting with the strip method. Follicular unit transplant through a strip method gives us the flexibility of getting a bigger number of grafts in one session. So we remove a strip of the skin, and based on the density of the hair and the size of that strip, we can have a significant number of follicles transplanted in one session. As you can see, we're talking about groups of 1, 2s, 3s, and 4s here. This is a patient right after surgery. May look a little bit bloody here, but it will go away after just 1 day or a couple of days after surgery. Patient's pretty much going back to normal after the first week or two. These are automated devices that are being used for FUE method. So FUE, we do it manually. We do it with actually devices, and based on the quality of patient's hair, everyone should be qualified for one of these procedures. Some people respond better to automated methods, some to individual and manual extraction of hair. Here is a patient right after surgery. As you can see, again, it's a little bit inflamed. As you see some little bleeding, but this is something that will go away soon after surgery. Again, another guy, hair follicular unit extraction. He's scheduled for that. We're covering an area in the front of scalp with FUEs. Here is he again after procedure. He's receiving probably around 1500 grafts. This is the view of the back of the head. You see small dots or small red dots that are the places that we remove hair from. This will be visible just like this with more magnification, and just 8 to 10 days after surgery, patient's back to normal. This is the view of patient that is growing his hair just about 10 days after his procedure. So there's no evidence of hair restoration done. The wounding or inflammation even. If you want to talk about a hair transplant overall, we can do bigger surgeries in one sessions. Today we're talking about giga session hair transplants. This gentleman has 3,957 grafts in one day, and as you can see, the change is significant. He's pretty much class 6. He doesn't have any hair on top and crown and front, and now after one surgery he has full head of hair, as you can see on the right. Another gentleman who had a surgery in the past. He had some little plug surgery, mini graft surgery that did not give him a good result. He had some plugginess in front and not enough coverage. We did another surgery, another big surgery, 39 grafts, one session, and we covered pretty much the whole front, top, and crown. Same patients, more magnified picture. On the right here you can see the plugs with more zoom, and on the left you see the view of the patient after 10 months from the hair transplant surgery. The plugs are gone. The plugs are removed during the surgery, but that was replaced with a normal, natural looking hairline behind that area.